The COVID-19 pandemic is affecting everyday hospital life in many areas. Interventional Cardiologist Dr. Dorman from Bristol Royal Infirmary explains why important examinations and treatments should not be postponed nevertheless.
So coronavirus has affected access to healthcare systems worldwide. Now in the UK, the NHS actually coped remarkably well during the pandemic. We had intensive care beds available for those that needed them, and we didn't need to use the spare capacity of the Nightingale hospitals. But with all the focus on coronavirus, other important health conditions got neglected. I think people were scared to come into hospital, they were worried about contracting the virus, and also they didn't want to be a burden on health services. And this is a problem because although coronavirus can be very serious, actually the majority of people recover very well. And other health conditions like heart valve disease, people won't recover well if you don't get treated. Now for conditions such as aortic stenosis and narrowing of the aortic valve, then that condition needs treating if your symptoms are getting worse. You need treatment either with a heart operation or with keyhole surgery with a TAVI. So as we move beyond the first phase of the pandemic, we need to ensure that people with serious health conditions like heart valve disease can continue to access services in a safe and a timely manner. Now, if you have heart valve disease, the commonest symptoms that you'll experience are breathlessness, particularly when you push yourself, or you may find that when you're walking, you can't walk quite as far. Some people will get a tightness in the chest, and other people will feel dizzy or have palpitations or near blackouts. Now, what I want to say to you is that these are serious symptoms, and if you find that they're getting worse, you must seek medical help. It's safer to do that than it is simply to wait at home, because your condition won't get better. So hospitals now have very strict protocols to try and prevent the spread of coronavirus. We use hand sanitizer, we wash our hands regularly, we use face masks in hospital, and we practice effective social distancing. And all of this is designed to minimise the chances that you could catch coronavirus if you came into hospital. So during the pandemic, cardiac surgical services have been affected more severely than keyhole services such as TAVI. So it may be that your doctor recommends that you have a TAVI rather than an open heart operation, and that would be a very sensible thing to do. So if you have been diagnosed with heart valve disease, then at some stage you will need to come into hospital to have it treated. And you need to be reassured that hospitals are doing everything they possibly can to minimise the chance of you catching coronavirus if you come into hospital. In particular now, we have a period of self-isolation before you come into hospital, and you'll have a COVID swab test done to be sure that you can't bring the infection into the hospital. Now also, for patients who do have infection with COVID and they're in hospital, they're treated in a completely different part of the hospital to minimise the chance of cross-infection. Coronavirus could be with us for months, if not years to come, and we've got to find a safe way to continue to treat heart valve disease because the risks of not doing so are just simply too high. So if your symptoms are deteriorating, you must seek medical help.